Yeah, so we are live. Hi everyone. I will welcome you to today's session on busting myths about C-section delivery by Apollo Cradle. To speak on this topic today, I would like to welcome Dr. Garima Jain from Brookfield. She is our in-house consultant, obs and gynecologist, and she has done her MBBS and DND. So we welcome you, doctor. You can take over the session now.
Right. Thank you, Shrishti, for the introduction. Continuing with the helping out patients with their education because knowledge nowadays, unfortunately, is available in plenty on the social media, where all of it may not be reliable. So, Apollo has always been constantly in this endeavor to improve the health of people, not just as doctors, but as otherwise also. So, continuing with the medical education for our patients, I thought I should take a topic, something interesting, something which is people have a lot of confusions about it, about a C-section, a cesarean section. This is something I think everybody has heard about it, whether it be from the city, whether it be from the village, whether it be a child, whether it be an adult, whether it is somebody in the older generation or the newer generation. Everybody knows about a C-section. But then the question is it good? Is it bad? Is it needed? Always there is a thing that my doctor did an unnecessary C-section, or because of C-section, I had gone through this, and this big myth that if you deliver in a big center, if you deliver in a big hospital, you would hardly land up with a normal delivery and it would be a C-section. And so I thought a few common basic myths that we have with a C-section. I would be more looking at the medical aspect of it, obviously being the doctor, though yes, with the so many years of experience, we know many other things also that people have doubts in their mind. You would be all most welcome to go through an interactive session. It is always easier and better to have an interactive session rather than going through like this. So I'm Dr. Garima Jain from Apollo Cradle Brookfield, senior consultant here with more than 20 plus years of experience. Now coming to the topic, busting the myths on the C-section. Like we know, pregnancy is a normal natural phenomenon, and therefore delivering a baby is also a normal natural phenomenon. And we know that every living being has a right to childbirth and produces and reproduces, and that's how we have been here for ages and do the same. The question is why in we human beings we have so much of a difficulty about having a reproductive difficulty not going through a natural thing. It's not that women cannot have a natural childbirth, but then we know that yes, natural childbirth or the normal deliveries are the best always, but then there are reasons when sometimes we have to do a C-section. Earlier, medical sciences were not so advanced. It was normal childbirth would be happening in your home with some guy assisting you, with four women around you, all the home facilities, wherein we knew there was a lot more increased risk of maternal mortality, maternal morbidity, and losing newborns or landing up with birth traumas and therefore having the newborn babies being mentally retarded. So gradually hospitalization so that women can have a safer motherhood was what was the goal. And then in this process, as safer motherhood started coming in, the goal was not only just to have a safe motherhood, yes, a safe mother and a safe baby. Therefore, at times it becomes empirical that we go ahead and do a C-section, maybe sometimes for the baby, maybe for sometimes for the better health of the mother. Also, now that we know as sciences are advancing, elderly age coming through, more and more assisted reproductions, more and more complications, more and more women with problems in their health are being allowed to get pregnant because we have better health facilities available with us. And therefore, in these kind of women, sometimes it might be difficult to help them out with a normal delivery, and therefore it might become necessary for us to do a C-section in these kind of women. So, for example, suppose you have a lady who is diabetic, 38, 39-year old, who has conceived with a lot of difficulties, who is on insulins on a very high dose, comes up with an early labor by around 34, 35 weeks. I may be happier to tell her, better let's do a C-section to save this baby. Suppose I have a woman who has conceived twins with an IVF. Then do I really want to risk her going till term and then going through a normal delivery and having complications coming in because of that and losing the baby or having a birth traumatic baby? May not be. Maybe I would be happier to say we should do a C-section. There are indications in the maternal health like a very high blood pressures where if we don't deliver the baby, it might be harmful for the mother. And suppose this mother is now in her 8th month of the pregnancy or the beginning of the 7.5 months of the pregnancy. I know at this stage, if I'm going to do a normal delivery, I would probably lose that baby. So in that situation, definitely it's better to go ahead and do a C-section. So is it that always we want to do a C-section? Definitely not. Is it that C-section delivery is always better either for the mother or the baby? Definitely not. There are indications when one should go through a C-section and when one cannot have a normal delivery and therefore should have a C-section. Or there are reasons when maybe we don't want to do a C-section, definitely not, and we want to give you a normal delivery always. So now coming to it, like what is a C-section? Like all of you are aware of it, C-section is one more mode of delivery. Thanks to the social media, thanks to the movies, Bollywood, Hollywood, everything now we know deliveries can happen vaginally when the woman is screaming, wow, and push, 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 and then it happens. And then, like in Three Idiots, the woman is tired and somebody has to pull with a vacuum or a forceps. So that is an assisted vaginal delivery or an instrumental vaginal delivery. A C-section is something where the child is not born through the normal birthing passage. We go ahead and cut through the abdomen of the mother so that we can help this baby to come out. So therefore, it is that we cut through the layers of the abdomen, then cut open the womb of the mother, deliver the baby, and then stitch back everything. C-sections have been documented, or there are history of C-sections officially documented even as early as in the 16th century, when women were cut open to help the baby out. But then, unfortunately, there was no anesthesia, there was no antibiotics. Women would be just cut open, delivered, and they would bleed and die or die of infections. But yes, C-section deliveries have been documented even as early as the 16th century. Even our older books, the Ayurveda Shastras and everything, also do talk about C-section deliveries. Though yes, there is not much data available on them, but C-section is something which was there for ages and is there for ages. The incidence of C-section has definitely increased because we have understood the advantages of doing a C-section to give a safer motherhood and a safer baby. So that is why we are landing up with many more C-sections. Can every pregnant woman have a normal delivery? May not be, may not be. It's not that you are wrong if you don't have a normal delivery. There's nothing biologically wrong in you if you land up with a C-section. Sometimes it's your baby's position is not in the right position. Sometimes the baby is too tired to take the labor. Sometimes your outlet passage is a little too smaller than for what your baby can take it. Sometimes you have a huge fibroid obstructing on that way. Sometimes you have had certain complications during your pregnancy because of which it is difficult for you to go through a normal delivery. Sometimes you might be delivering extremely preterm. Sometimes you don't go into labor, right? The world data says that 15% of women don't get their labor pains even till their due date. And therefore, we are forced to induce pains. And many times it does happen that even after trying our best methods of inducing pains, the pain just doesn't set in. And if the pain doesn't set in, then we are forced to go ahead and do a C-section because waiting longer would land up with autism in the baby, birth trauma in the baby, and many other complications. Sometimes your labor is just going on and on and on and on, and it's not coming out. The baby is just not coming out. Your uterus is not just yielding, and we have to do a C-section. So, what are the common myths attached with a C-section? Why is everybody scared about going through a C-section? Yes, even as a doctor, I would say I would be worried to do a C-section on a woman because I know when I'm doing a C-section, it involves anesthesia, it involves me cutting up the layers, therefore bleeding, wound healing, infection, and like you hear in movies and otherwise forgetting instruments inside, forgetting gauze and mops inside, which is something definitely which doesn't really happen because we are extremely careful. But then yes, these are all practical complications which can happen, and therefore even we as doctors don't want to do C-sections unless we are forced to do it. Now, what are the common myths? What scares a woman to go through a C-section? The most important thing that I have heard, especially in the COVID times, from every woman, Madam, my family support can't come through. I have to be all on my own to manage. I have an elder baby and this baby, or this is going to be my first baby, but my mother can't come. My parents can't travel. I don't have family support to come in. I'm not in India. I'm staying outside India. My family is not in a city from where they can come in. My family is from a small village and they may not be very comfortable to come to a bigger town. And I know C-section takes longer to recover, therefore I don't want a C-section delivery. Well, no, let me be frank about it. C-section deliveries do not take longer to recover. In general, at Apollo, we have a policy where we give you packages for your deliveries, wherein, yes, normal deliveries, the package is for 2 days, and the cesarean, the package is for 3 days. But frankly speaking, 90% of our cesarean patients also go home on the second day, and 80% of our normal delivery patients also land up staying back till a little extra than 2 days to learn the feeding and everything, because one of the days of the package is over in laboring and delivering. So practically they've been with us only for 1 day for the recovery phase kind of a thing. So does C-section women take long? Do these C-section women take longer to deliver or to recover? No, C-section recovery isn't as bad as people think it might be. Is a C-section delivery much more painful than a normal delivery? Not really. Yes, because when we are doing a C-section, we give you anesthesia so you don't feel the pain. We continue with good amount of pain relief, which is safe for you to while breastfeeding the baby, so you wouldn't feel the pain. Even in a normal delivery, you go through pain before you deliver. Yes, there is the option of epidural labor and analgesia, and then there is option of pain relief that we continue for you later on also. So is cesarean much more painful than a normal delivery? No, a cesarean is not much more painful than a normal delivery, especially when you are delivering in a bigger hospital like ours. We're going to help you out with your pain relief. Nobody wants a mother to be struggling with pain. I don't believe in this that no pain, no gain. Yes, no pain, no gain is true, but that does not mean to say when you have options to be comfortable, a woman should hate becoming a mother because it was so painful that tomorrow when you think of your baby, you have tears shedding down your eyes, not happiness, the pain tears that, oh my God, it was such a painful experience to go through the delivery that I wouldn't want to go through it again. Tears should roll down a woman's eyes with happiness, the thought of having a baby, the thought of being able to take care of the baby. So, motherhood should be a happy moment. Tears should be with happiness and not with sadness. Therefore, we will give you adequate pain relief when you're going through, whether it be a cesarean or whether it be a normal delivery. So, this concept that recovery takes longer or my cesarean is going to be more painful, no, definitely not. This is a myth again people have with the cesarean sections. The next common question that I hear from most of the women is that I wouldn't be able to breastfeed after a cesarean section. No, you would be able to breastfeed after a cesarean section. Gone are those days when you would deliver in a hospital, even healthy babies were kept separately in a nursery from the mother, whether you have a normal delivery or a C section, and the baby is handed to you only when you're getting discharged. In the meantime, you're just asked to go up and feed the baby. That concept is totally gone. The concept of rooming in came in. Now the concept is bedding in. That means the baby is not just in your room, the baby is with you in a crib or on your bed with you. So even if it is a C-section, even if it is a normal delivery, there is something called the golden hour. The golden hour is that within 1 hour after the baby is born, we should be able to put the baby to the breast. And we do follow that initiative here. In fact, there are times when we even allow the mother to start breastfeeding the baby even before the cesarean is over, because the anesthesia that we choose here in our setup is always a spinal anesthesia. Unless there's an absolute contraindication, which is a local kind of an anesthesia or a regional anesthesia, wherein the mother is awake, chatting with us, seeing her baby, hearing her baby, holding her baby, and also breastfeeding the baby. This thing that if you don't have a normal delivery, you will not get the milk coming in is wrong. The production of the milk does not depend upon your mode of the delivery. The minute your placenta has separated from your uterus and the uterus starts contracting, your body starts producing hormones which tell your body that there is a baby, there is a requirement to breastfeed, whether it be a cesarean, whether it be a normal delivery, you will start lactating. Will you be able to handle your baby? Yes, you will be able to handle your baby even if it is a cesarean section. There is nothing that because it's a cesarean, you should be lying down like a statue and you can't move for the next 24, 48 hours. The stitches will open up, or when you sit to feed the baby, the pressure on the stitches will be harmful. No. Courtesy science, courtesy advancing technology, courtesy we understanding anatomy better, courtesy we understanding surgical techniques better. This concept that I would not be able to handle my baby, I would not be able to lactate, is totally gone. This is again a big myth that if you are having a cesarean, you can't breastfeed the baby. Will the baby be kept away from you? No, the baby will not be kept away from you unless there is a reason from the baby's side. In the sense, I suppose it's an extreme preterm baby. It's a baby which is born like 1 kg, 1.2 kgs, 1.3 kgs, or there are complications in the baby. Then maybe we have to keep the baby for observation. But then that's equally applicable whether you have a normal delivery or a cesarean. It's not because you had a cesarean, your baby is separated from you. So a baby is not separated from a mother for the mode of the delivery. It is the health of the baby and the health of the mother that determines whether the baby would be kept with the mother or not. For that matter, like you're all aware, when the first COVID wave came in, we were all like COVID babies, COVID mother babies, no giving the baby to the mother, keep the baby away from the mother. Second wave, we all said, let the mother continue to breastfeed the baby, let the baby be there with the baby mother. Third wave, we all said no difference. Treat a mother with COVID positive as good as a mother without COVID positive. Let her enjoy everything of a motherhood. Let her handle that baby. So even with such a condition, when we say keep your baby with you, wouldn't we give the baby to you even if you have had a cesarean section? No. So that's again a big myth that if you are having a cesarean, you will not be able to keep your baby with you. The next common myth that we see is you don't bleed. Okay. Now, this is something which people say that when you have a cesarean, oh, I thought because it's a cesarean, all my kachara has already come out. And why would I bleed? My mother said it's only in a normal delivery you bleed because all that kachara should come out. And the doctor is supposed to clean up everything after the cesarean section. So you wouldn't bleed. No, my dear girls, my dear women, my dear mothers, would be mothers, you would still bleed even after a cesarean. Whether it be a cesarean or whether it be a normal delivery, there is something called the lochia. That means where you have the bleeding after you deliver. The first few days, first 10 days or 2 weeks or 3 weeks, it is what we call lochia rubra. That means it's red. Rubra means red. You have blood. Then it becomes a lot of discharge along with some bleeding with it. That is the whole concept of 6 weeks of your recovery phase. So whether it be normal delivery or whether it be a cesarean, the body mechanisms remain the same. So you would bleed even after a cesarean, maybe a little lesser, but then you would still bleed even after a cesarean section. The next myth, I had an anesthesia in my back and therefore my back is paining. I am 40, I had a cesarean 20 years back and still my back pains because of that anesthesia which was given to me. No, anesthesias don't give anybody a backache. The needle that we poke in an anesthesia is so thin, so thin, so thin that we sometimes wonder can we even see the needle? It's so thin. So it does not injure your back in any way. It is whether you have a normal delivery or whether you have a cesarean. It is the way you sit to feed your baby, your postures post your delivery while you're lactating. That is very important to avoid backaches. Similarly, making sure you're taking your calcium supplements while you're breastfeeding the baby. That is very, very important to avoid the backaches. 90% of we Indian women tend to sit cross-legged, and so we bend forward. Half of the times in the night when we have to feed the baby, we are like, I'm too tired to get up. Let me lie down and feed the baby. Let me just sit up on the bed and feed the baby. I'm bored of taking those calcium tablets. So after 2 months, I'm fed up and I forgot to take the tablets. This is when you get your bad backaches coming in. The right posture to feed your baby is very important, and I'm sure every hospital teaches a mother how to sit to feed the baby. I know it might sound very funny when we teach something as basic as how to sit to feed the baby, but yes, this is also very important to help you so that you don't have bad backaches. Similarly, the calcium supplements should be taken till a mother is breastfeeding the baby so that you'll catch up with all the calcium losses that you are having while you're breastfeeding the baby and you don't have bad backaches. The next concept that women have, when I have a normal delivery, I will get into shape and I will lose weight very fast. But when I have a cesarean section, I will not get into shape. I will not be able to lose weight. Weight loss immediately after the delivery, whether it be a normal or a cesarean, is the same. You lose about 6 kgs within the first 10 days. That's your placenta, your baby, the water retention that you have had. After that, it depends on how much you breastfeed the baby, how much you eat, and how physically active you get. If you are not going to be doing any exercises, you will definitely have back a lot of weight retained from your pregnancy. If you are going to be those kind of typical mothers, I am pregnant, so I need to eat for two people. I am breastfeeding, so everybody told me I should eat 5 meals in a day, and then I should eat this and I should eat that. And now I constantly feel hungry. And so it's 1 year since my delivery, but I still eat 5 meals in a day. Definitely, you're not going to lose weight. You have to put in your efforts to lose weight. The weight reduction, be it a normal delivery or a cesarean section, because of the process of the delivery, happens within the first 2 months. After that, it is your efforts that help you to get back into shape and lose weight. And if you are good at it, 90% of the women would get back into their pre pregnancy weight or pre pregnancy shape by the first birthday of the baby. So it doesn't matter whether you have a cesarean or you have a normal delivery. This concept that if I have a cesarean, I can't exercise, no. Within 1.5 months after your childbirth, whether it be a cesarean or a normal delivery, you can start exercising. You need to start exercising. There is nothing that if you have had a cesarean, you can't hit the gym hard, you can't do planks, crunches, you can't swim, you can't bend down. I do see a lot of women, oh, madam, I had a cesarean, so I can't sit cross legged. Oh, madam, I had a cesarean, so I don't bend down to pick up anything. I can't use an Indian style toilet. No, nothing like that. Even within a week to 10 days after a cesarean, you're fit to do all of it. Getting back into shape by doing the crunches and the exercises, whether it be normal or cesarean, we do say wait for 1 month and then you can start off. Or rather, for the first 1 month, you're so busy learning to become a mother, trying to learn to breastfeed the baby that you hardly get time to exercise. So there is nothing that if you have had a cesarean, you can't get back into shape, right? I can't eat food. My mother told me after normal delivery, as if there are so many restrictions, and because I've had a cesarean, I can't drink milk, I can't eat non-veg, I can't take ghee, I can't take dry fruits. And this is something, yes, in the northern part of the country, we have that after cesarean, oh, your stitches will get infected, so no milk, no curd, no ghee, nothing of that kind. Whether you have a cesarean or whether you have a normal delivery, you're most welcome, and we want you to eat healthy. Remember one thing, your baby gets food from what you eat. What you eat converts itself into calories, proteins, and nutrition and goes through the breast milk to the baby. So if you eat chola, chola is not going to the baby. If you eat only khichdi, it's not that the baby is getting khichdi to easily digest it. It is whatever you eat is getting converted into nutrition and through the breast milk reaching the baby. So if you don't eat healthy, you won't have enough nutrition for the baby. So you need to eat healthy. And there is nothing that because there is a cesarean cut, you cannot eat healthy. You need to eat as good. Your digestive system is not disturbed because we are doing a cesarean. From day one, you are allowed to eat whatever you want to eat. It is not that you had a cesarean, so you can't eat dals or you can't eat deep fries or anything. You're as good as anybody else, even after a cesarean. So, this myth that I can't eat food is also gone. The other myth is that once a C section, always a C section. No, once a C-section does not always mean a C-section. There is something called a VBAC, that means as a vaginal birth after a cesarean section, wherein if you have had a cesarean section for a particular indication, it is not necessary that the next time the same complication may be there in the baby or the mother. We may be able to give you a normal delivery the next time. So this concept that once a C-section, always a C-section is again fastly changing. Earlier, it was said that only about 7 to 10% of women would have a successful VBAC. But now, with better technology, better monitoring facilities, understanding these concepts better documentation, better knowledge to the patients when they get discharged after a C section, better documented OT notes and histories from the previous C section, definitely our VBAC success rate is increasing to about 30 to 40%. So, these are all the myths that people have against doing a C section. But there is a huge fraction of women who come to us saying, Doctor, I want to have a C-section delivery because I've heard it's got its own advantages. I don't need to go through the pain of a normal delivery. We do have its own complications when we do a cesarean. I heard that when babies are born through normal deliveries because they get pressed, they get through all the trauma, and so when the babies come out, the baby's head is like that and it is out of shape. If I have a cesarean section, my baby's head will be nice, round, and gundu. So I want to have a cesarean section. No, my dear girls, whether it be an elongated head or whether it be a round head, it will all get back into shape within a few days. Whether it be a normal delivery or whether it be a cesarean, we can have the same, we might pose the same difficulties in pulling the baby out even in a cesarean section. And therefore, sometimes we may have babies even with an abnormal shaped head, even in a cesarean section. So just because my baby's head will be nice and round, I don't want to do a C-section because 3 days after a normal delivery, my baby's head will be again nice and round, even if it was a prolonged labor. So it really doesn't matter on the shape of the head of the baby. Now, people have told me that there will be no complications if I go through a C-section. Doctor, you are all very good now. Technology has improved now, so we can easily go through a C-section. No, yes, it can come with its own complications, like I said, wound infection, bleeding, complications in the subsequent deliveries. All of them are higher when you have had a C-section. So I would not want to do a C-section just because I think it is less complicated or I can run away home faster. Lesser suspense? Yes, definitely. If you go in for a planned elective C-section, you see your baby within half an hour of getting admitted into the hospital. When you go through a normal labor, it might take you 10, 12, 16, 17 hours to finally go ahead and see your baby coming through. So that way, maybe yes. But when I have waited 9 months, one more day, Isn't it really worth the wait to have a nice baby coming in my hand? So I would always say a normal delivery is a normal delivery. Always the advantages of a natural process going through a normal delivery is always better. But at the end of it, if there is a medical indication, if it is prudent for the health of the mother or the baby, we should go ahead and do a C section. So I have only one advice mainly for all the would be mothers: don't be obsessed about a normal delivery, don't be obsessed about a C section. Leave it to your doctor. No gynecologist is in a hurry to jump into a C section. We know what complications we can face. At the same time, no doctor wants to unnecessarily do a C section on you, thinking that I can finish work faster or run home faster, or I might get more money after doing a C section. Again, this is a myth that people have. Hospitals earn a lot more, and that's why they do a C section. No, dear, we lose a lot more money when we do a C section. And normal delivery is much more easier, much more cheaper for a hospital than doing a cesarean section. So we do make more benefits or this in profits probably out of doing a normal delivery than doing a C-section. So I wouldn't want any mother to think that hospitals do C-section for the sake of the money. Doctors do C-section because they are so busy and they don't have time. Doctors do C-section because they can finish their work in half an hour and go, whereas in a normal delivery they need to sit and wait. Doctors do C-section just because they feel they should do it. None of us would want to do a surgery on a woman. When birthing is a normal process, we want it to be as normal and natural. But at the end of it, the outcome, I should have a healthy mother, a healthy baby, a happy mother, going home healthy with taking home a healthy baby with them. That is when we choose and decide who needs to go through a C-section and who doesn't need to go through a C-section. Will the loose skin go away after a C-section? Well, the loose skin has got nothing to do with a C-section or a normal delivery. During the process of a pregnancy, through the 9 months, as your tummy is stretched like a balloon stretches open, your tummy is also stretched, and therefore, when the baby is born, there will be some loose skin, there will be some hanging skin, there will be some laxity in the muscles. Whether it be a normal delivery or a C-section, unless you exercise, it's not going to go off. And it is not that because you have had a C section, you can't exercise. You can. Within a month after C section, you start exercising and you're as good as a woman who has had a normal delivery. The next question that we have is: will C section cause any problems later? Yes, C-sections come with their own complication rates, and therefore we are always happier not to do a C-section. So suppose I have to do a C-section for the first time, I know the chances of complications are lesser. When it is a second cut on your tummy, I'm also always looking at more complications. Suppose you have had two or more C-sections. Tomorrow, God forbid, for any reason, I need to intervene into your uterus. I need you to go through a hysterectomy surgery. Definitely, the chances of complications are higher, and therefore, no doctor would advocate you to go through a C-section unless at that point of time when you are pregnant and looking at the delivery, there is a complication which we know would be better if we do a C-section. Say, for example, I have a breech baby. Breech is something where the baby is not in the head down position, the baby is in the leg down position. Yes, there is a role of trial of breech deliveries, but then we all know that the complication rates in a breech baby is always much more higher than a cesarean section. So maybe there I would choose to go ahead and do a cesarean section rather than going ahead and waiting and seeing, and then seeing after 1 year, oh, there is a problem with my baby. No, I wouldn't want to do that. So I think so. With that, I would like to conclude my session saying that yes, C-sections are there. C-sections are going to be there with us. C-section deliveries are needed and required for the better health of the mother and the baby. The target that any hospital would try to achieve is having a primary C-section rate, cesarean section rate of less than 30%. There are indications when we cannot give you a normal delivery, but I would always request every prospective mother: don't go and ask your doctor for a C-section. Let your doctor decide whether you can have a normal delivery or not. Don't get scared about going through a labor. Go through your laboring sessions. Go through your classes. Every hospital is nowadays encouraging antenatal classes where we are helping you come out of your fears of going through a labor. We are having the options of epidural labor analgesia, which would help you to take your labor better. But at the same time, don't be obsessed and say, oh my God, I tried for 18 hours. I did everything, doctor. I went through yoga. I did everything. How can you not give me a normal delivery? My dear girl, sometimes it becomes difficult. Sometimes it is for your own good health that it is better we do a normal cesarean section. Instead of damaging you permanently, instead of having your gallbladder going off permanently, instead of the baby being paralytic, instead of the baby being cerebral palsy, it is better sometimes we go ahead and do a C-section. Therefore, though, yes, normal delivery is the thing we should all be targeting, but safe motherhood, safe birthing sometimes requires us to do C section. So, wish you all prospective mothers a safe motherhood and a safe delivery. I hope this session was useful for all of you. Bye.
Thank you, doctor. This was a very informative session.
Thank you,
So,
Shri. Right, so we sign off this day?
yes.
Okay, then. Yeah, bye bye.
Bye bye.